COVID-19 has sparked fundamental ethical debates. Think of the terrifying reports from hospitals in Italy. Intensive care units were overrun with patients. There were not enough ventilators. And suddenly we asked ourselves, what is the value of a human life? Who gets a ventilator and who doesn't? And how should we even decide? First come, first serve? Or based on age? Based on pre-existing medical conditions? Another ethical debate concerns the lockdown. What is the value or the utility of the lives we save through the lockdown? And how does it compare to the economic costs incurred by the lockdown? To be clear, the foremost goal of the lockdown is to save lives. Criticizing the lockdown based on economic arguments alone is therefore pretty heartless, even more so at a time when thousands fight for their survival. But the costs of lockdown are by no means only economic. A recession leads to widespread misery, social, physical and mental misery. It also lowers life expectancy. We could thus argue, if we don't do a lockdown, we will save less lives now, but we will mitigate recession. Therefore, we will save more lives in the future. But this is hard to justify amid a raging pandemic. And it is also unfair towards healthcare professionals. Without the lockdown, hospitals will be overrun. This means that we would knowingly expose doctors to the moral dilemma of doing a triage between those worthy of treatment and those not worthy of treatment. If a lockdown can avoid this, we also owe it to the people working in hospitals. The pandemic has sparked an intense debate on privacy. It is clear, we urgently need to contain the pandemic and we need to monitor its spread. But there is a danger. The urgency could give a strong push to surveillance technology. It could justify the use of tools that under normal circumstances would not be acceptable. How much should we trust digital monitoring? Can we opt out of it? Or should digital surveillance decide who can move around freely and who is quarantined? We might also wonder, will the pandemic serve as a pretext for using particularly controversial tools? For example, some companies have already started buying thermal facial recognition cameras. They use it to screen their workers for COVID-19 symptoms. There is a legitimate worry. Once such technology is in use, it could rapidly become the new normal. In the end, it could be used on a much wider scale and for much longer than effectively required by the pandemic. After the crisis, we will hopefully all be aware that we're all in it together. We will have learned that local context matters. We will acknowledge that it is impossible to live in an entirely virtual bubble, no matter how much tech allows us to do things remotely. Currently, we are locally confined. We realize the importance of being embedded in a local community. We depend on the community in which we live, and we depend on the state where we pay our taxes. We therefore need to assume responsibility here. We need to look after each other. We cannot walk through the streets with our eyes glued to our phones. Social distancing means that we need to coordinate our ways. In short, we can only survive as societies if we practice solidarity. Solidarity across generations, solidarity across professions, and solidarity in our community. There is an intense debate on digital contact tracing. I hope that one day this debate will be led with an eye on solidarity. At the moment, the key focus is on privacy. And this is true. Depending on the type of technology that is used, depending on the place where data is stored, and depending on the actor behind the technology, we really should worry about privacy. But there are apps based on decentralized proximity tracing that ensure privacy. Let's assume that the data these apps collect is accurate. Let's moreover assume that digital contact tracing is used in combination with other measures, for example, in combination with human contact tracing and with comprehensive testing. If this is the case, digital contact tracing makes an important contribution to the common good. It serves to spare as many people as possible from getting infected, At the same time, it allows a maximum amount of freedom to those without exposure to the virus. These people can then move around freely and earn their living. From this point of view, opting into digital contact tracing is a contribution to the common good, and it is an act of solidarity. COVID-19 has moved science center stage. Epidemiologists have become quasi-rock stars. Yet it has also provided a fertile ground for conspiracy theories. Existing theories expand and new ones pop up. Yet in many countries the dialogue between policymakers and scientists has worked quite well, at least in the Western world. But COVID-19 has also emphasized the importance of widespread science literacy. It is unrealistic to expect that citizens understand all the science behind the virus. But they need to be able to and feel comfortable with asking critical questions. They need to engage in critical debates about COVID-19. If they don't do that, society risks to be bypassed by experts, and this could undermine democracy. COVID-19 also brings to light the specific importance of data literacy. Think about it. Before COVID-19, when was the last time you had thought about the meaning of exponential growth? Did you even know indicators like rate of infection? And how often did you really look at charts and curves? All this has changed. We are all confronted with massive amounts of data, new types of data. It is important that we understand that data. From now on, data literacy deserves a firm place in the educational curriculum of every country. And governments must publish and explain the data that underlies their measures. We must not entirely delegate our responsibility to policymakers and scientists. Or, to end with an input from the German philosopher Kant, we need to maintain our ability for critical reasoning. No matter how complex the circumstances, the key is to never lose the courage to think for ourselves.